So I remember in my residency days, we operated a scoliosis patient starting from 10 a.m. in the morning till around midnight, 12 midnight. So that was like 14 hours long surgery, and the routine spine surgery takes somewhere around 2 to 4 hours, you can say. But if spine surgery can go as long as 10 to 14 hours for scoliosis surgery, which is a complex spine surgery, or for even routine surgeries. If you're wondering how the patient is positioned for such long hours or even for routine spine surgeries, whether they face up or face down or lie on the side, or you are the patient been told surgery and you are wondering how I'm going to be during surgery, then this video is for you, where we are going to understand how patients are positioned during spine surgery comfortably for such long times. Welcome to my channel Zen Spine. My name is Dr. Rakesh Dhake. I'm a consultant spine surgeon certified by the Royal College of Surgeons of England and currently practicing in Mumbai. So to understand patient positioning during spine surgery, it starts right from shifting the patient from a trolley to the bed, to the operating table, you can say. Now, when we shift the patient after giving anesthesia from trolley to the operating bed, we make sure that we shift the patient in one alignment, that the patient rolls as a single unit from head to toes in one go. Now, this is important that we don't twist neck or any part of the body, because if there is instability or fracture in the spine, then yes, it can further cause more problems or injury to the patient, and hence it is important that we turn the patient in alignment. Now, once the patient is turned facing down, or what you can say prone position, then what you can see here in photo is different things that we put underneath the patient to make sure every part of the patient's body is protected. Now, starting from the head, what you can see here is the head foam, what we call, has a gap in the center to accommodate patient's face and patient's eyes so that they are free and not pressed or pressurized. If the patient's eyes have pressure, then this can cause serious problems like blindness, and hence it is very, very important to make sure that eyes are free. Now, what you can see is the slot underneath that. The slot in the head foam is for the intubation tube or the ET tube, or you can say the anesthesia tube to come out from the head foam, and then it is connected to an external circuit or anesthesia machine. Now, once the head is free, we check the patient's neck. It should not be too flexed. It should not be too extended. It is better to keep it in a neutral position. So we make sure that the alignment of neck is neutral. Then we check the shoulders of the patients, that the shoulders are free and the axilla are free. And then if we check the shoulder and axilla, then we rest the patient's arm on what we call arm rest, as you can see in the diagram. The usual angle between shoulder, elbow and rest of the limb is 90 degrees at these points. And the arm rest also has cushions so that elbow is not pressed upon, or the nerve that goes underneath your elbow, usually the ulnar nerve, is not compressed and is free. Now, having checked that, as you go down, we see these two bolsters on the sides on which the patient's body rests. The side of the patient's body rests on the shoulders. The abdomen or the chest is not compressed, and there is a gap between the two to accommodate the patient's abdomen. If the abdomen is not free, then it can cause blood pressure, and then that can also cause more bleeding during surgery. So it is important that we keep the patient's abdomen free. Now, coming down, we also check the private parts of the patients are free. It is not compressed. Then you can see below are two blocks which is made of silicone. It is made of jelly, and this jelly makes sure that the patient's knee are not pressed upon and are supported on a soft cushion or jelly. Then the tube coming down is what is for the warmer, because after we cover the patient, we want to keep the patient warm and cozy, because the temperature in the operation theater is usually very cold. So we want the patient's body to be warm, and that is why we pass a tube or a warmer underneath our drapes to keep the patient warm. So if we check all these points right from the head to toe, and if these all points are free, then you can say that we are safe to proceed for surgery. And most of the times, even if this surgery goes longer, we don't have to make any adjustments, and the patient is usually okay after they wake up. They might have some numbness on the anterior part of the thigh because of the bolsters. So that is one complication. If the surgery goes for long, they might feel some numbness on the front of the thigh. Otherwise, Usually, if all these things are taken care of, the patients are absolutely fine after surgery, even after long hours of spine surgery. So I hope you got a fair idea of how the patient is positioned during surgery. If you have any interesting things to tell me or you want to know something, please do feel free to write in the comment sections and we'll get back to you as we get time. If you want to reach us, please feel free to WhatsApp us, but not for treatment or suggestions that I won't be able to give you on WhatsApp without seeing you or consulting you. In that case, you please book an appointment. Otherwise, to just know in general a few things, you can just WhatsApp us or write in the comment below. We'll try to help you as much as we can, but not give you treatment on WhatsApp. Thank you so much. Have a good day. Have a healthy spine.